Okay, I'd like to call to order the November combined meeting of the Rutherford County Health and Education Committee. We'll begin with approval of the minutes.
So moved.
Second.
All right, all in favor?
Aye.
Okay, Health Department reports. Let's get it. Her new haircut,
Yes.
very cute.
Thank you. Good evening.
Hey. Hey.
Okay, so I have the, because of our changing of the days, I don't have the November data yet to get that. So I brought our October report to show you our numbers where we are there. It's kind of, we're still seeing an increase in our WIC numbers and the WIC demand in Smyrna. So we're opening up more appointment slots and making that. You can see they're easily catching up in the with the Murfreesboro site. There's a big demand at that end of the county for those services.
Is that a matter of new citizens moving to that part of the county, or?
A little bit of both. We have new people moving in to that end of the county, more people learning about that end of the county and that they have more open slots than coming down to Murfreesboro, that kind of
So
thing.
Murfreesboro's not
And then-
decreasing?
No.
Smyrna is,
They're increasing, yeah. So our overall numbers in that program are going up. And we kind of expected that when we built the new building. We added some new staff to increase that. And because we knew that the residents were telling us we'd like to be able to come to Smyrna for that service, and for the ones that were currently there, and then also the new people who are moving in. So we've seen that increase month after month. We're seeing that.
is it 100% federal dollars?
Yes, for our WIC program. We have some county dollars that support the building, maintenance, those kinds of things, but the program itself is federal.
Thank you.
Lots of cool smoking initiatives. We've been working on our tobacco initiatives throughout the county, and we've offered a few more of our Smart Mom trainings where doctors and nurses can be trained how to talk to patients who are pregnant who are smoking, how to convince them and counsel them and get them to the not smoking section. And I want to say we're up to 60, close to 60 moms in our county that have chosen to stop smoking that were, and this has been a 2-year project. So really impressed with those numbers. And
What's that percentage?
And that percentage,
Yeah, the 60.
well, we have 11% of pregnant moms that smoke in Rutherford County. That's our number. And so I'm not exactly sure to
Is
say
this-
right off the top of my head, but I could find out.
Out of this 60,
Mm-hmm.
is this the first time pregnancy or
We haven't tracked it that way, so I'm not sure if they'd be first-time pregnancies or not. But also, convincing, trying to talk to people who live in the home if they're going to continue to smoke, to make sure they go out, trying to have a safe environment as well for when the baby's born, or siblings that might be at home as well.
I was just wondering how the comparison would be from if it's the second child or the third, from the first to second, I was just wondering.
Yeah,
how it would-
exactly. We partner with MTSU on that. They developed this program with the March of Dimes. It's evidence-based. It's been studied for 10 years, and it shows success, great success in these programs. So they kind of do our research analysis on it, so I can ask them to look at that as far as our numbers. But,
I was wondering what an impact it would be from one birth to another.
right. Well, they tell us the average birth of a baby that's born not of a smoking mom, and the birth of a baby that's born to a smoking mom, more likely to be small birth weight, more likely to have problems on delivery. So the average time in the hospital is longer. The average cost is around $66,000 versus $3,000 for a normal delivery. So if you just look purely at cost, your program saves a ton of money. And if you remember, the money that started this program came from tobacco settlement dollars that our Tennessee representatives decided they would give back to the county some of that money that is brought in, and it was $5 million that was given out across the whole state, and our county got $103,000 of that money. It was based on number of smokers and number of residents, And then we continue to get that year after year as we're showing these great impact with just a little bit of spending. So it's really awesome.
Talk about the two fall festivals you have listed there, the Canonsburg and McFadden.
Yes, yeah, so both places we did a lot of, in our community needs assessment that we did, we discovered that one of the greatest needs, people don't understand how to connect to resources that are out there. I think that's not a surprise to you guys, because you know you'll get people who'll call you and you'll call me and we'll connect them up to the right place. We've got so many great resources out there, but a lot of times people don't know how to connect to them. So that's part of what we do at some of those outreaches. We had booths where we had our Tender Care Kids, or Teen Care Kids program there, teaching people about what services are offered to Teen Care, how to get on them, how to connect to things. Then we also had our health educators there talking about all the different services in the community, what we offer at the health department, and how you can utilize. So that's one of the ways we try to attack that need that continues to show up on our community needs assessment, that people want to know a better way how to connect to the services.
Flu shots? Still?
Yes, flu shots still available, and we do them at both sites, 8 to 4:30. You can come in, no appointment needed. So still important to get them. We haven't hit the peak of flu season yet, and it's still an important.
Still $30 or sliding scale?
Yes, that's exactly right.
Okay.
Good memory.
On the flu shots.
Yes, sir.
I hear people all the time tell me they think back to when it used to be years ago. I'm not going to take a flu shot. They'll give me the flu.
Yes.
But as long as we're on TV,
yes.
the drugs nowadays are not the old live viruses that were used 20, 30 years ago. And what are the chances of somebody getting the flu from the flu shot?
Absolutely none. Absolutely none. I mean, the research, there's years and years and years and decades of research, and that is something that we continuously hear. Rutherford County does a really good job of vaccinating. When you compare us to Tennessee, but if you compare Tennessee to the rest of the United States, we're really far behind in vaccination, and I hear that a lot when I'm out in the public. And so I do a lot of education about this is not a live virus. It cannot give you the flu. It will prevent, and people say, well, I still got the flu. There's different strands. You can still get the flu, but it's been proven with hundreds of research topics that even if you get the flu, once you've had the flu shot, you'll recover quicker. So you might only be sick for a few days or a week versus 3 weeks, or in a hospital if you're elderly or have other issues that are going on. It's so, so important, especially for people with any kind of health concern, elderly, and the very young. But it's definitely recommended for everyone. And you do have to get it every year. It doesn't just stay there like some vaccines. You have to get it every year.
For the older population, I know some physicians recommend a pneumonia vaccine. Do you do those as well?
We do have those as well.
Okay.
Absolutely. And you can do those again, walk in. I'm not exactly sure on the cost, but it is fileable to Medicare and sliding scale. So.
Well, get a shot for sinus.
Yeah.
That's one.
Yeah.
I don't need the flu like I do the sinus.
That's right. That's right. Yeah. Get on that.
Thanks. Any more questions for Ms. Garrett? I'll accept the motion to approve the report.
So moved.
Second.
All in favor?
Aye.
Very good. Do you have something else for us?
Yes, please. I have, so we always kind of laugh about this because it usually comes in about December. But so you guys budget and have that all approved and everything, and then the state writes up a little contract that's what we've agreed to do. So this is really just my paperwork to clear up what y'all have already agreed to give for our operations. And so I'd like permission to take that on to budget and get that approved and taken care of.
So it's really just a housekeeping item? We have
Yes.
this every year?
Yes, every year. It's several months after you all have already approved your budget.
This is the 706, 706,000, is that what it is?
Yes,
And that's our portion?
yes, that's your portion. from
And
the-
that's a little bit more than it was last year,
Yes, 35,000, I think,
that's
more than it was last year.
basically because of a new position and the related benefits.
Yes, yes, you're right. We added a position and then we cut back in other areas to try to decrease the cost as much as possible to
Move
add
to
that
approve,
position.
Madam Chairman.
Second.
All in favor?
Aye.
Very
How much is the state's portion this year?
My overall operating budget is 5.2 million. I looked at Helmy's human calculator, but.
Their portion in this agreement is 2.57 million.
That's
That's their piece.
kind of the same as it was in the past. You know, with a county that's growing like ours is, I just wonder if there's an opportunity for, with growth, for more funds available. It's going to be important just to serve the need, the increased need in the future. I wonder how that works, how they determine what the amount is.
Yes, and a lot of that they use on data and research that I produce and give to them and show them of the number of needs in our community, number of people coming through our doors, number of people we're reaching out to. And they have increased a few things this year that would not show on this. We have another contract that we do with you guys, and it's a state reimbursed county. And on that, they added a few new positions that we needed help. We needed more health education because, again, third year in a row, our community needs assessment said we need more health education in our community, so they gave us a new health educator. So some things like that can kind of line up, and sometimes it'll show up on state dollars, or sometimes it will show up on that other contract that's not here that represents about another $2 million, and that is where we'll pick up some new positions and things that we might need, sometimes for operations.
Every county has a health department.
Yes, every county has a health department, and some have multiple sites like we do. We have 2. Sumner County has 3, so but there's at least one in every county.
Thank you.
Yeah.
Of course, the legislators will be here next Tuesday. We could talk to them about next Tuesday's steering meeting. That could be a thing on the list for.
Just wondered if you could see, you know, the 95 counties, and with the amount of money that they're getting, kind of mirror what the population is.
Right.
Like Memphis as an example, or Shelby County having the highest, and
Right.
where we would.
And they're, of course, a metro, so ours are considered rural. There's 89 rural, and then there's the metros. So the metros are, you know, different as far as how they get their funding. It comes from their city and their.
Probably has something to do with average income, would it not? I mean, I would think that Williamson County may not get as much money as a county that's not as affluent, not have the money.
Right,
You know,
and their
because a lot of
population
it
is so much
dependent on
smaller as
income and
well.
things like that.
Exactly. Yeah, and the services needed in that community as well. Like in some counties, they only need WIC 2 days a week, you know, whereas we run it 5 days a week. And
Any more questions? Very good. I'll
Okay.
see you in January.
all right, thank you guys.
Community care report. Ms. Carol, do you want to talk to us about community care a little bit? These are both their November and December reports.
Well, I was sorry that I wasn't able to, sickness kept me from going to the November one. But on December, our survey has been completed and we're doing well. And so we've had a lot of obstacles, but we have managed to go through them. So
This was from the change in using restraints and things like that. Some of the, we're talking about the survey that you went through.
yeah, and we've been certified again, so
Okay.
we can do it.
Mayor, do you have anything you wanted to add?
No, we're back in compliance.
Excellent.
Still financially sound.
Yes.
I'll take a motion to approve both reports together.
Motion to approve both reports.
Second.
All in favor?
Aye.
Good. All right, special projects. Hello, Ms. Jelly. They've all had this report for a little while to review. Is there any changes you want to point out to us?
We've actually had some action in the Oakland Middle project. You know, that one's been sitting, nothing's been happening there. We actually had some purchase orders come through on that one, which is on page 4. Not much, but just a little bit. And this is just the normal
Okay.
purchase orders and paying of invoices.
Starting to see a little action, it looks like on the adding Rocky Fork to it.
Yeah, I finally did that.
What is the EESI?
That's the, is it lighting?
Energy
Energy
Efficient
Efficient
Schools Initiative.
Any more questions for Ms. Jolly?
Motion to approve the report.
Yes.
Second.
All in favor?
Aye.
Thank you very much.
Thanks, Chris.
Mr. Sandick, School Board.
How are y'all tonight?
Good.
I have one of my routine budget amendments. It's for classified staff. It cleans up $36,905 in already budgeted pay for the classified hourly staff and related $5,635 in related benefits. These changes reflect the staff we now have in place. There are a couple of vacation payouts for people who left and were paid out their vacation in July or later. One of our routine entries. This is like 0.15% of that budget. It's yeah. But our recommended motion is to amend the 2015-16 general purpose school budget by $42,540 in classified staff and benefits as presented.
Any questions about the amendment? I'll accept a motion to approve.
Move to approve.
Second.
Okay, all in favor?
Aye.
Oh, sorry, roll call.
Commissioner Cook,
Yes.
Commissioner Dodd,
Yes.
Commissioner Gurley,
Yes.
Commissioner Jordan,
Yes.
Commissioner Phillips.
Aye.
Commissioner Reed,
Yes.
Commissioner Allen.
Aye. Very good, thank
Thank you very much.
you. Who was it?
If we have some pretty tough questions for you, Jeff, you just don't want to answer them, you go away.
I'll do my best to answer.
There was an article in today's paper, did you see it, about kind of moving the schedule up some?
Yes, the board did discuss, we presented the building program. No, my file was dated November 12th, I don't remember. But we gave them an initial copy, they wanted a couple of changes made, and then wanted some time to look it over.
I was being a little facetious about the tough question, but the paper indicated that it might come before the full commission, the county commission in January.
Well, but it would not go to the full
And
commission.
I don't know how it could, it gotta come
No.
before this committee
Right.
first, right?
Right.
Okay.
Yeah, no, we are anticipating bringing it to y'all at the January meeting.
Okay.
And the board is very concerned about our high school situation. The last 2 years, our highest growth percentage rate has been high school.
Right.
And yeah,
Which is not the norm. That's not.
which is not the norm, and we've had, I don't know if we have any proof, kind of that anecdotal evidence. It may be children who were homeschooled as they're hitting high school age, the parents deciding it's time to get them back in public schools. We do appear to, some of the increase appears to be caused by that. But obviously, if we continue with that, that's close. It's double or 250% of our normal growth rate. And
Moving it up would affect the new Rockville, proposed Rockville
Right,
High School,
yes, sir.
right?
Mhm.
And that's within a stone's throw of Eagleville High School.
correct.
And I'd like some explanation, just me, as one particular member of this committee, like some explanation as to how that proposed high school is going to affect Eagleville High
And
School.
I will have to defer to the instructional
I know
staff
you
on
will,
that.
but
Or
past
Jeff,
that-
I would warn you to tread lightly. I nearly got shot after asking some of these questions about 5 years ago. You know?
I'm not in favor of affecting it all,
Yeah.
but I want to know
Mhm.
what
Yeah.
the board's recommendation is, not ours,
Yeah.
okay?
I just asked a question about the proximity of the 2 high schools, and Lord, my email blew up, my phone blew up, and I was threatened.
That's what
my
I want.
life, you know.
Is the board's explanation as to how
Absolutely.
how that new proposed high school in Rockville is
Right.
going to affect that end of the county in Eagleville. Not us, Will, the board, okay?
Jeff, you probably could find Jimmy Hopper a lot easier answering that question. But when you said a stone's throw, I'd like to see you throw that rock.
Well, comparatively speaking, is what I'm saying.
You have to go by the way the population is growing, and
That's-
that's what I think the school board's looking
Yeah.
at that.
And
I
we
have gone through that discussion quite a bit. I can tell you that, and what we're seeing there. And I've gone through some, I guess I've gone through some pretty heavy promises. I mean, you know, when we say the effects or whatever, the thing you have to look at when you talk about Eagle School out there, Eagle is a quite unique school in the way that it is made, in the way that it can be affected, I think. It's very special. And I know we do not want to affect it in any way.
That's not my suggestion.
Yeah.
My suggestion is, where are the Eagleville High School students going to come from? Where are they going to come from?
Rockvale High School.
No, the Eagleville High Schools. I want to know
Oh.
how that's going to be, how the students and where they live and where they're going to come from, and also Rockvale. I just think there needs to be some conversation on that. I don't want to get a
Jeff,
building
you need
that high
piece of-
school and then it
piece
kind
of
of
paper.
explodes.
Oh, I can write it right in my Sudoku book.
Okay.
Yeah.
If it doesn't affect Eagleville at all, that's just what I want to say. This is where they're coming from, and this is where they're still going to come from.
I think, which I hesitate to speak for the superintendent or the board, but just as discussions have come up with the future Rockville High School, we believe with the growth we're seeing in that part of the county, Blackman, Stewart's Creek, the impact with Smyrna then being, you know, there's kind of a roll forward effect as Smyrna gets higher in a student population. Blackman is the natural place to provide some relief. Then you'd have to have relief at Blackman and Riverdale. So I think the thought is there will be enough students with growth in other areas to make Rockvale High School a viable school. So, but yeah, I will get that word to Mr. Oden.
Of course, we've studied this a lot in years past.
Yes.
That we've already bought the property and built the pad, and now
Yeah.
we're ready to bring the school out of the ground right
Right.
there. You know, and
Yeah.
and I know there's been a lot of discussion in years past. That's when I made the same type of comment, maybe a little more directly or whatever, but I live to regret it.
And
Same
Commissioner
evening,
Phillips,
you know.
my email is already clicking. Would you like to have that?
I don't know how much more clear I can make it. I want to know what the board's plan is. I want to know what the board's plan is. Everybody listening out there, I want to know what the board's plan is.
I think the board's plan is to keep Eagleville a K-12 school.
I understand that, okay.
And of course, we have to have a viable number of students in order to do that. Yeah.
You know, some of the high schools that are Blackman, Smyrna, Stewart's Creek, all of those down there, we build a high school and then 3 or 4 years later we build another high school, and we're constantly moving those students around.
Yes.
Constantly,
Mhm.
okay?
Yes.
And that was the reason that I asked that. How is this going to affect Eagleville? Will there be some kids that are going to Eagleville right now that will be forced to go to Rockville?
And one of the issues that, of course, the building of that school would change. Right now, there is that, and I don't even know if I think we still have that dual enrollment zone where the kids can opt. Well, I would, not being one who votes on zoning issues, thank God, I would think that might well become option Rockvale or Eagle, but the board has not
Well,
addressed it.
I would just think that if there are some young high school age folks that are going to Eagleville right now that live closer to Rockvale, is it going to affect those? And would that be the board's decision and?
Yes, that would be the board's
Yeah,
decision.
And I want to know that, okay? And I think that people in Eagle will want to know that too, so.
Of course, it seems like it's right down the road, but Pettis, what is it, 8 miles, 9 miles probably from
in between
one to the
9
other
and
at least?
you're 9
It's probably,
better.
it's probably about the same distance from Riverdale to Rockvale,
Yeah.
to the site, or from the Rockvale site back to Blackman. And the Blackman site to Stewart's Creek is closer than you realize, you know,
Yes.
it's, so they're all within
Yeah.
7 or 8 miles of one
Yeah.
another, so it seemed like, well, just right down the road, but, you know, because last time I was out there, it was farther than I had, because I don't drive it every day, than I had thought in my mind
And
it
that's what
was.
most people, whenever they come that way, they say, "Oh, we didn't know it was this far out here."
Yeah.
And I can show you the mileage on my truck and tell you how far it is out there.
It's 8-point-something miles from, roughly from Murfreesboro. It's about, from about Riverdale out there. It's about 8 miles. My question is, a couple of questions. One, regarding the increase in high school students. Are we seeing any increase in retention and increased graduation rates?
I'll have to defer.
Could we get an answer on that? Because it's
To
part
that.
of this, are people staying
Sure.
in school more?
Oh, are-
If that
and
is
I
the
think-
case,
I think we are
then
in-
that's a good thing.
I think we are holding our own, we're in good shape on that piece of our graduation rate and all that. We aren't seeing, we've been in good shape on that. We've seen improvements there. And we're holding at least where we were.
Yeah, I would urge the board also to keep up with what's going on, very much so in terms of building. I was just at a city council meeting here, and there was, a fairly large development right there next door to Stewart's Creek, annexed into the city.
Yes.
There's another one upcoming. There's one pending for down the road to the tune of 1,500 houses. And Stewart's Creek is already full, pretty much full. So, as that end grows, you're gonna see students, some of those Stewart's Creek students are gonna have to be shifted back to Blackman or wherever, or something, or is there gonna have to come something in between there, so keeping in tune with what's going on in terms of building that's happening right now. That's yes, it's just being approved right now, but that means 5 years from now you're going to have a bunch more students of all grades.
And, yeah, and typically those developments are built out over time, so.
Over maybe a 5-year period.
Yeah.
But
Well,
still,
it may be
you don't
longer
build
than
a
that.
school is overnight.
Exactly. But we do need to be smart and know they're coming. And that, Jeff, I think that is something that, you have a planner who knows all the
Yes.
lots that are being approved, and
Mhm.
so they're already tracking where the
Yes.
growth is happening,
And
and,
the thing we have to watch, and the thing that really, the economic downturn,
right.
we had all of these lots out there that were approved and
One day it goes.
Have not been built.
have not been built. But in that Rockvale corridor, there were a whole lot of approved lots. And I know some of those,
We've got 1,000 platted that, somewhat sitting, waiting,
yeah,
plus new plats. That's just Rutherford County, that's not the city.
yeah.
I think some of our growth is we're a victim of our own success.
Oh, yes.
We've got a group of students right here from Central Middle, and Central Middle's got some of the,
That's Central
not all our
Magnet.
schools don't.
Central Magnet.
Central Magnet, sorry, I went Central Middle, it's Central Magnet, sorry, my mistake. But Central Magnet's got a lot of the kids that used to go to Webb, or go to out of county, or go to some of the private schools, and all our schools are doing such a good job. We've got a lot of families that are deciding to not forego public education and go to the private sector because we're doing such a good job, and stuff. So, and that's putting more kids in classes, which is a good thing, of course. But we still have to pay for it and provide a seat for it. But it was Central Middle when I went there about 4 years ago. It seems like. Wasn't it, Phil, 4 or 5 years ago we were there? Something like that?
40 years ago.
4, something like that. 4 or 5, maybe 6.
Anything else from Mr. Sandy?
Thank you very much.
Does anybody Anybody else have business for this committee?
Do just reiterate the steering committee meeting with our state legislators on the 14th, Ernest? Will? What night is
Yes,
the?
next Tuesday night.
Tuesday night, the
I'm not
15th.
on turn, I wrote it down.
15th.
It's the 15th.
And that's just
Tuesday,
crucial
15th.
for the citizens and for us to attend.
To attend
15 at 5:30
in the courtroom.
in the courtroom.
And then, our next committee meeting is January the 26th. Yes, sir. 5:30. Motion to adjourn? Thank you. Merry Christmas.